Oh, yeah, that's the spot. Oh, baby! That would have just happened. Woo-hoo. Oh. Sicko, Nick. Hey everybody, this is Dr. Warren Kalkstein here at Kalkstein Chiropractic. I'm getting treatment today for, I haven't got dry needle in a while. I went for a run this morning, took a big old spill in the woods, felt a big old pop on the outside of my ankle, and now I got a little window of opportunity right now, and Dr. Nick is going to be coming in here and taking care of me. So first, ankle sprains. Nick, what's the most common lower extremity injury most athletes sustain in their career? What's the most common? Most common.
Most common. Sprained ankle.
Sprained ankle. Super common.
You didn't even get your shoe off.
It's gonna be like a suction cup coming off right now. So I've been working a little bit. It's a little swollen, just a little bit. And so we're gonna show you for treatment what we would do here on me for a patient coming in. So I'm grateful that I get to work in a place that treats sprained ankles. Kendra, go to chiropractic school. Kendra behind the camera. She's an assistant in the office, and she's heading to chiropractic school in the fall. So we'll ask her some questions. What happened, Kendra? What do you think happened to my ankle? I'm coming in, I got a swollen fat ankle.
Pop the other shit off.
You want to do a little comparison?
Yeah,
I actually do want to see the comparison.
Okay. Alright, and then we'll do a video showing you guys later on the PT that we do. We'll do like kind of a quick run through with the exercises, the name of them, how often I do it. We'll kind of make a quick little montage. Just to show you the kind of the complementary of different things that we use to get this stuff feeling 100. So I did a little ice bucket already today. Thanks, man. So swelling here on this, let's call your lateral malleolus right here. Here's your medial malleolus. When you have a sprained ankle like this to what's called the calcaneofibular ligament, it's a ligament right here, and that's what I heard pop. It's usually a grade 2, grade 1, sometimes a grade 3 sprain to the ligament. Grade 3 being complete rupture, grade 2 more than 3 to 5%, I think it is. Minor strains are in that lower range. From a treatment standpoint, it's how it responds to care is what you really usually know with this type of ligament strain. So no imaging is not required. Treatment right away, seeing how it's responding with care, PT, manual therapies, and then we're going to use dry needling over the ligament, the muscles here. You can see how swollen this part is here. My foot was in a downward position like this, and then all my weight went that way. So these muscles that help dorsiflex and evert my foot got lengthened and pulled and strained, and probably some tearing in there too. So I am just a little bit, I'm going through my grieving. I'm pissed. I'm pissed because I can't mountain bike, can't do stuff I like to do. So I'm so grateful though, back to the grateful, for Dr. Nick and his mustache, his dry needling abilities.
It's still like so. This might work.
So what's the game plan, Doc?
Well, I would suggest we needle it. We do some laser, probably above, just to kind of open up the channels to help funnel that swelling out. And then ice. Never hurts to ice.
I stuck it in an ice bucket today, and it's not that bad, but it does temporarily burn a little bit. So to compound that, I just went to my comfort food. I ate peanut butter crackers. Ate a whole package of peanut butter. Salted. Apparently, that's what I grabbed on my way out. Ate some snacks. Had some ice time. Scarlett was crawling around in the grass. So with dry needling, usually we're doing it on more chronic injuries in the office, sometimes acute sprain strains like this, or acute back spasms. Oh, Lord help me. Whew! I'm
Yeah.
one of those guys.
We should just did a video earlier today with DB with his finger.
What did he sound like?
Oh, he's a sailor.
I can't relax this.
Yeah, I know.
Oh, baby. Yeah, I just can't rest it because it wants to go down, but now it's all twingy. Let's just get it to relax.
Do you want a pillow up under the heel?
You throw one underneath my calf. Golden, just one of those. Actually, I got one. I told myself I wouldn't be a baby about this. It's Happy Veterans Day, Dr. Jeff's Day. Did you guys say Happy Veterans Day to him?
Mm-hmm. First
My
thing
mom
this
sent
morning.
me a picture of him. We put it on our Instagram. I think Luke's gonna put it on there.
Uh-huh.
It's like him without a mustache in the middle of this group with his navy tie on. It's pretty cool.
It's the first thing Heather said to him today, and he looks up. He's like, "Is that what today is?"
My neighbors were like, "Oh yeah, we got off today. It's Veterans Day," and I'm like, "Oh, that's kind of ironic. This would be the last day my dad would ever take off." You can come on in. Hey, how we doing?
How are
How we doing?
How are you
Oh,
doing?
we doing.
Yeah, I got 2 more for you.
Oh, baby, that would have just happened. Woo-hoo. Sicko, Nick. So, as we're getting, the stuff above is really where I had a lot of the muscular strains. There's a lot of inflammation there. The ligament damage, where he's going to go in with some halves and kind of just pepper it a little bit, is more on the inferior portion of that lateral malleolus, so kind of hooked underneath there. And so if he kind of rolls his fingers up just a little bit north, there you go. Like right there is like a hot spot. It feels like when he presses on that area, it's very taut, tender, irritated. So it's gonna feel like that a little bit when he puts the needle in there. It's gonna feel like a little bit of like a boom right there, baby. Sorry for the loud noises if you got headphones on.
Last one left through it.
Oh, yeah, that's the spot.
And there she is.
Yeah.
You're here for 10 minutes. You just gotta relax.
Kendra, why are we dry needling this? You don't know? It's okay if
I'm
you don't
tripping
know.
up. I get anxiety on camera. I
Oh.
hate videos. Like, I
Oh.
don't like talking.
I think that a lot of people do. I think a lot of people can relate to what you just said. Thank you for your honesty.
Honestly, though.
Well, my first time Blake had me go on camera, I was just out of school. I had no idea what was going on, like in terms of the
Yeah.
office flow. This is like he puts you in the most awkward position.
He does,
sometimes.
yeah.
But I was good. I got over it. For dry needling, what do we normally do it for? Like in most cases, there's 3 main categories. What most people come and see us for.
Should I tell you how a patient actually thought I was a doctor?
No.
So I dressed up for Dr. Alec, like as Dr. Alec for Halloween, and they came in like the Monday after and was like, "Are you a doctor? Like, can't you do the needles?" I was like, "I'm not a doctor." I'm like,
the Halloween video with you walking with
Scarlett.
It's really sweet.
I know.
That's really sweet.
She was having a blast.
The people love Scarlett.
They do.
Do they?
Yeah.
Yeah.
That's all the comments were really, just Scarlett.
I love her too. She's so cute.
She is.
She was crawling in the grass today for the first time. Trying to
Oh, God.
dodge her away from where I know Cam's going to the bathroom.
Oh, yeah.
But she did so good. So, hey, baby. Cool. I always find that fascinating that there's a little bit of like, especially when it's swollen like that,
Not the worst of them.
with like the little blood. You'll see my mobility start to improve. The swelling will go down. The bruising will start to come in, and it'll pull in here. they'll pull back in here. There's a little bit of swelling on my deltoid ligaments, and then it'll be right here as well. Hey, Kendra.
Yes.
Whoa, Kendra, that's the coolest look ever. So we do class 4 laser therapy over the tissue.
Yes.
Why do we do that?
That repairs damaged tissues.
It definitely assists in the repair of damaged tissues. So we drive a lot of stimulus to the mitochondria of the cell with class 4 laser. That's the theory behind it. Blood flow to the tissue increases cellular activity. So I'm trying to make this site as active as possible in the healing process. And class 4 laser is a really great way to deal with it in that manner. It also helps with pain too.
What settings do you want?
We're going to do 8, go to 10 watts, 3200. Just keep it moving when you get over the malleolus. It might get a little warm. So the wattage of a laser, class 4s have watts. Class 3, you're going to just get your cold level light laser. Not a big fan of those as much. Class 4, you have a wattage there, and it's a certain number of nanometers of wavelength. Basically, just the depth that it gets to travel is a little deeper. So this medical device allows us to get deep heat to the tissue, cellular activity, and the wattage that we refer to is how much power is behind it, and the joules is the 3200. That's how much energy is going to be transferred into the skin. And then the third factor is just time. Cool, so she's going to work up that top of the foot here where that's the significant strain occurred to the muscles, and then probably half the time is going to be spent there. A little lower, Kendra right there is perfect. And then we're going to work up the tissue, like Dr. Nick said, to help with some of that swelling and lymphatic drainage, and then definitely over the ligament itself. We should be doing a live video.
Live?
We're going to jump on YouTube Live. You ready?
Can you actually do that?
Yeah.
From the camera?
Not from this camera. We'll jump on our other one. So she's going to spend the next 10 minutes buzzing this thing. Jump onto our YouTube site for a live video. If you want to check it out, we're going to do a little... I'm going to make the most of my time sitting here.
Oh, yeah.